So this is the first bill, which is banning pharmaceutical ads to protect public health. And just to give some prior context, this is talking specifically about like direct to consumer ads, which is all pharmaceutical ads essentially, because direct to consumer ads are when companies like pharmaceutical companies advertise products and drugs directly to the consumers without any middlemen like healthcare professionals. So they just directly advertise it on mass media, whether it's television, social media, or like radio. And the main purpose of this bill is to, of course, limit the airing of pharmaceutical ads. So it bans pharmaceutical ads from broadcast, so television and radio, from 6 a.m. to 10 p.m. And those specific times are mentioned because those are considered the prime time where most people watch TV. So it actually targets most of the viewers when it does that. And especially in this time is when most of the impressionable people watch TV. So whether it's younger audiences who are easily likely to get tricked, like young adults, or like older audiences as well that might watch it during that time. And one important thing to note with this, because a lot of neg arguments might talk about how it's not actually fixing the problem, is that in section 1C, it clearly says, when it outlines the restrictions, it outlines also that no emotionally manipulative imagery or tactic shall be used in any pharmaceutical advertisement. So that's covering all pharma ads, not just the ones within that time. So that's something important to note when when giving your speeches, because it does actually ban all emotionally manipulative imagery altogether, overall trying to make pharma ads more objective and less about the emotional appeal to audiences. As well as this, it also forbids testimonials from actors and like miracle recovery image, also focused on emotional appeal essentially. And the enforcement of this bill will be overseen by the FCC and FDA, so they'll share the responsibility of enforcing it through both the communication aspect and the healthcare regulation aspect. And for every one infraction that a company makes, so every single time they air an advertisement, they will be fined up to $500,000. So that is a significant amount, and it will, at least in my opinion, incentivize companies to actually follow this rule, because otherwise they will be fined a very hefty amount. And in the end, it also talks about how the FCC should find a way to enforce this with respect to the First Amendment. So it clearly also talks about the First Amendment. So overall, this bill aims to reduce misinformation and like over medication risk, and all the things I talked about are things that we should keep in mind when presenting speeches.